Hello, hello. Okay, we're gonna make this short and sweet because my phone is about to die and we had to fight off Corbin. He has been stuck to me wanting to put him down for the last few weeks. So Brandon was like, I'm gonna put him down. I'm like, fine. So I just got done exfoliating. Tell me hi when you jump on. Let me know if this works. Drop a 1 if you can hear me and a 2 if you catch the replay. Hey, Christy. Oh, Brandon, why are you watching? You should not be watching with the baby. Hey, Micah. Hey, Linda. Okay, so we're going to do Detox and Dental Talk. I know it's been a little while since I've been in here to do that because Wednesdays seem to always just be crazy. So we're going to talk about oral cancer, but while we do that, let me put my mask on first because it's my night to detox. Anybody else masking? Hey, Lori. Hey, Brittany. Oh, gosh. Oh, gosh. Hey, Andrea. Hello, Michelle. So if you share this, tell me. And honestly, I'd share it with anybody that has a mouth. Hey, Elena. Hey, Elisa. All right. Hey, Michelle. Oh, there's another Michelle on. Okay, let me put this on. So I already exfoliated. You can see I'm kind of red on my neck and chest because I like to exfoliate my neck and chest as well because I'm trying to stay young. Who feels me? Look at the mask already working. Okay, anybody else masking tonight? Hey, Jim. How you doing? Okay, so we're going to talk about oral cancer because what I have found with my patients is it's very underlooked. It's not talked about a lot, and it's actually one of the most common deadly cancers out there. Okay, so we have about 5 to 7 minutes, y'all. Look at this working. Holy guacamole. If you like instant gratification, you'll love this mask. Okay, hey Teresa, hey Susan. Okay, so I research everything and I don't remember everything, but I research and I take notes on everything and eventually I kind of memorize it. And if Lori's still on here, she's gonna recognize some of these pictures. Hey Jennifer. So, okay, did you know, sorry y'all, it kind of itches, the rate of oral cancer diagnosis in America has increased every single year for a decade, okay? Drop a wow face. Every single year for a decade, oral cancer increases. I have mask on my top lip, so it looks like I have no lip. This is gonna wow your pants. 1 American dies every hour from oral cancer. 3 Canadians die every day from oral cancer. Oral cancer is approximately 3 times the incidence and twice the death rate of cervical cancer. Lori, you're saying yes. And oral cancer is twice as prevalent in men than women. And I am totally okay with that for the fact that women always have the short end of the stick when it comes to most diagnoses and illnesses. Women always get the short end of the stick. Hey, Leanne. Hey, Keisha. Okay, so I wanted to come talk to you and give you some stats, but I also kind of wanted to show you. So you need to ask your dentist, like, okay, so when you go in to get your teeth clean or see a dentist, we always check the tissues. Always, always, always. But what you can see with a naked eye, hey, Brianna, hey, Brandy, is if we see something abnormal with the naked eye, it's usually pretty far along, especially if it comes to oral cancer, okay? And I talk about this a lot with my patients because we always check head and neck and, you know, you can check yourself. You can like feel around on your lymph nodes, up underneath, you know, you can look at your tongue. You can see any abnormal. But by the time the naked eye, hey Bailey, hey Rosie, by the time the naked eye sees something in the mouth, it's pretty far along. So not all dentist offices have this, but I think they will get it because it's now the easiest thing that I have ever seen. And when I'm passionate about something, I like use it and implement it and talk about it. And I probably could sell the poop out of these things to every dentist office. But we have a Visalite Pro, which is this little light. It's like a stick and it has a light, and you look through it and you can see. Okay, so I'm going to show y'all some pictures. I got them laminated, and these are what I use to show my patients. This is the nerd coming out of me. I am a true nerd. If you are a true nerd, drop me some hearts. I hope my kids are true nerds. I love to learn, and I am a cool nerd, but I'm a nerd. Okay, so I hope y'all can see this. So here is a picture of a regular tongue, okay? When you look through the light, this is what we see in the light. So it looks normal, right? But when you look through the light, you see kind of a darker spot. And this is a severe dysplasia, basically, okay? Lesions appear as irregular dark areas under the light. In the mouth, they look normal. Let me show you some more. Because the palate is where so far I have seen areas that we watch and that we refer for on the palate, the top of the mouth. Hey, Colbs. Hey, Aubrey. I feel like this is going to take longer than 7 minutes because I'm so passionate about it. But look, okay, so this is what a normal inside of a mouth looks like, right? Or not normal, but this is what it looks like from the naked eye. And this is what we see under the light, okay? See how we can't see that? This is the same patient's oral cavity, and that has a little bit of mild dysplasia, okay? This is another person. They have low-grade mucoepidermoid carcinoma, which carcinoma is the word you want to not pay attention to, or you don't want to hear. So this is what it looks like when we look in the mouth. Under the light, it looks like this. Do you see the difference? So in here, we can't really tell anything's going on if we're looking with the naked eye. But right here, look what we see. Okay, so this is why I tell all of my patients, hey, Quartz, Colby, it's not yucky. We're showing oral cancer, okay? Hey, Curbs. Okay, so people don't understand why it's important. I tell all of my patients once a year at least, especially if it's normal. If we see something, here's carcinoma in situ, okay? So under regular light, this is what it looks like, all right? That's the inside of a cheek. Like kind of in the back corner of their mouth, like, okay? Under the light, look at that, with a light. See the dark spot? And this was carcinoma inside too. We can't see that with the naked eye. So that's why I love these lights. Let me see. So this one, I don't think I've showed y'all this. This is mild and moderate dysplasia. So mild dysplasia, view under the naked eye, and then the same person. So this is, look, naked eye. See that black spot? With the light. This is moderate. So this is somebody's, looks like they might have dentures. Yeah, this is somebody with dentures, and they have moderate dysplasia right back here. So, I like to educate and show my patient these because, y'all, let's be really honest. Historically, the death rate associated with oral cancer is particularly higher, not because it's hard to discover or diagnose, but due to the cancer being discovered late, okay? That is huge. It's not possible to detect it without the light. Once you can, but that's what I just said. The death rate with this cancer is high, not because it's hard to diagnose or discover, but usually with the naked eye, it's too late, okay? Whew. Anyways, so I got some stats on it. I'm like choking over here. Somebody said something, hold on. I miss working with general. I work in pediatrics now, which is, oh yeah, no, I can never just work in pediatrics. I like all things. I love my kids, but I love a good SRP. I like to clean, clean, clean. Okay, so let me find my stats. I wrote some stats down. With the naked eye, y'all, often oral cancer is only discovered when it has metastasized to another location, likely of the lymph nodes of the neck. So if it moves there, it's progressed, it's a lot further along. Prognosis at that stage is significantly worse, clearly, than when it's caught in just the oral area. All right, let's see what else. Oral cancer also can come without pain or symptoms, okay? A lot of people are like, oh, nothing hurts. Well, because if something hurts, yes, every dentist should have this Invisalign. Where's my girl Lori? I'm about to make her rich. Okay. Lori's a hygienist if she's on here. She's a hygienist, but she's also our rep that we get like laser tips and stuff from, and their company has this light. Okay. There are several types of oral cancers, and 90% are usually squamous cell carcinomas. Let's see what else. Oh, the demographics of those who develop this cancer have been pretty consistent. I used to work in a dental office. I learned a lot. Yes, you do learn a lot when you work there. Majority of the people are over the age of 40 at the time of discovery, okay? But now, as everything else is, starting to occur frequently under this age, okay? The HPV virus, number 16, y'all know all the viruses have 85 numbers, right? The human papilloma HPV virus number 16 is a pretty common cause of oral cancer, okay? There's also links to young men and women who use conventional smokeless cigarettes or chewing or spit tobacco, like dip or the pouches or whatever those things are people put in their mouth. Let's see what else I wrote down that I think y'all would appreciate. Basically HPV and y'all, HPV is real in people's mouths. Let me just be real. I've had multiple we've diagnosed and HPV is in people's mouths. Yes! Lori, I'm so glad you're on. Denmat.com. Visalite. Where's it at? Visalite Pro. It's the best thing ever. Our old system, y'all, we used to have to turn all the lights off in the office, make them rinse with this nasty thing, and then look. Now we can just look with this cool light. Okay, let's see. 2 men to each woman. So it's not really that much higher. It used to be 6 men for every woman, but now it's 2 men to each woman. But that's because there's more common like HPVs causing it in the mouth. If you're catching my drift, it's shown to be sexually transmitted between partners. Oh, geez. Okay. Risk factors, I think I already said over 40. There's a lot of good information. I mean, you can just like Google. I mean, Google knows everything these days. So if you Google oral cancer, I'm sure you can find some really cool pics and some really good information. Hey, Terry. Hey, Lindsay. Tobacco and alcohol are also chemical factors, but you can also get it from physical factors like UV radiation. That's a lot of people that have like cancers of the lip, like skin cancers too. Cancer of the lip is one kind of oral cancer, but those have declined because honestly, a lot more people are cautious about skin cancer, so that's good. If you have a lot of head and neck, really strong x-rays, that can cause it. Not dental x-rays, because it would take like 50,000 dental x-rays in one day to hit your quota for the day. So, but like really strong, like if you're constantly going to get like MRIs and CAT scans and stuff, that can help cause it. Signs and symptoms, honestly, in the early stages, y'all, it can go unannounced. It can go unnoticed. It can be painless. Very few physical changes. That's why a light is good. But that's where we can see stuff like that or tissue changes. It may appear as a white or red patch of tissue in the mouth or a small indurated ulcer, which looks like a common canker sore. Like sometimes though, you can like bite your cheek and that can mimic a look, but your mouth heals pretty fast. So if something doesn't heal quickly, I would go in and just have it looked at if it doesn't heal within like a week or two, okay? A lump or mass, which can be felt in the mouth or neck, clearly is not normal. Pain or difficulty in swallowing, speaking, chewing, you know, the things that aren't normal of the mouth, I would definitely. Any like masses in your mouth, hoarseness, which lasts for a long time, like a hoarse, raspy voice. That's not a normal hoarse, raspy voice. I have a raspy voice all the time. And any kind of numbness. How does it develop? We know that all cancers result from changes in your genes, which control cell behavior. So mutated genes may result in cells which grow at an uncontrollable rate, blah, blah, blah. Anyways, so it takes more than one mutation to turn a cell cancerous, though, just so you know. That's kind of too scientific for y'all, because not many people care about scientific like me. Treatment of oral cancers, honestly, is ideally a multidisciplinary approach, in like surgeons, radiologists, oncologists, chemotherapy oncologists, dentists, nutritionists, rehab. There, it just depends on where you're at in your stages. Chemo, even though it's able to kill cancer, it's not used as a monotherapy for oral cancers usually. A lot of people, it's more so they do radiation or just cut it out, depending on what it is. So anyways, I really just wanted to come live and kind of make people more knowledge on how prevalent oral cancer is, because I have a lot of people who shrug it off. A lot. I'm actually really surprised how easy this is and how many people shrug it off. Like, nah, I don't care. You should care, because you don't want to lose your jaw. You don't want to lose the roof of your mouth. Like, you should care. So, and especially if you're a smoker or a drinker, or you carry the HPV, or you have a partner who does, that kind of thing. Anyway, so that's my talk for Detox and Dental Talk. I know it's a little more depressing because it is about cancer, but I feel like it's something that needs to be said. So, drop me some hearts so we can like lighten this up and have fun. And I'm gonna wipe this off and finish drinking my 1 glass of red wine for my antioxidants, right? One of my patients told me today he didn't have any stain on his teeth anymore because he barely drinks wine, and I was like, why? And he about died laughing. Anyway, so we have a good time with my patients. I love my patients. So I hope you all have a good Wednesday, and I will see you later. Bye, guys.